So there's actually no typical presentation of NTM infections in children. Typically NTM pulmonary infections in adults present with chronic cough, but in children that's been found to be associated with both chronic cough, wheeze, and stridor. So there's no one thing that fits all children. Pulmonary NTM disease is typically seen in adults, and typically in those adults over the age of 60. So it's actually not looked for a lot in children. It just happens to be that we almost incidentally found it in a lot of the kids that we were evaluating. So at this conference we presented 4 different children who had chronic cough. They were all treated with traditional asthma therapies and were found to be refractory to those. They all underwent further clinical evaluation with bronchoscopy and grew NTM or nontuberculous mycobacteria on bronchoscopy culture, so bronchoalveolar lavage. After that, they all underwent imaging with CTs and were found to have bronchiectasis, so they all had this combination of chronic cough, bronchiectasis on CT, and growing NTM, specifically MAC or Mycobacterium avium complex, on their pulmonary cultures. So there's guidelines that were put out back in 2007 by the American Thoracic Society as well as the Infectious Diseases Society of America that recommend treatment with a macrolide, either azithromycin or clarithromycin, along with ethambutol and rifampin. And that's the treatment that's recommended in adults. There is no standardized pediatric treatment because it's such a rarity. So typically we follow the adult treatments and go from there. So just about everything. NTM is a rare disease as it is in adults and is not wholly known. And the disease entity in pediatrics is relatively rare. Most institutions don't have even 4 cases that they can present. So there's a lot to be done both in the adult world and in the pediatric world. We don't know if the pediatric disease is similar to the adult disease, if it's a completely different entity, if it's something that's an indolent course where the pediatric disease leads into the adult disease. So there's a lot of work to still do.